Hello everybody. Today we are going to demonstrate how to properly perform hand hygiene as well as donning and doffing of personal protective equipment, otherwise known as PPE. Before we go to the demonstration, let us first look at the different types of transmission-based precautions. I will discuss three. Firstly, airborne. This is when droplets which are smaller than 5 microns are suspended in the air. It spreads when people who are sick cough and sneeze. These microorganisms then stays suspended in the air and can be inhaled and causes infection like tuberculosis. Droplet. This droplet is larger than 5 microns and it is slightly heavier. So it does not stay suspended in the air for long but lands within 1 meter of the infected person. This can be inhaled and cause infections like diphtheria. Lastly, contact. Microorganisms can spread from one person to another through direct contact with the infected person or the environment of that person with illnesses such as COVID-19, influenza, etc. Personal protective equipment or PPE is very important in the prevention of spread of these microorganisms. There are different types of PPE. We have the isolation gown or a water-resistant gown, mask, a N95 face mask, a respirator, gloves, eye protection or face shield, and goggles. It is important to take note of the following with regards to PPE. The type of PPE you choose to wear will depend on the procedure being performed. Know the type and size of PPE for the procedure to be performed. PPE is available to protect healthcare workers from exposure to infectious agents, so it is important to wear it correctly, using the right technique and sequence for donning and doffing. PPE must be worn before contact with the patient. Remove PPE before leaving a patient's room, except for your masks and eye protection. Perform hand hygiene before wearing PPE as well as after with the alcohol-based hand sanitizer for 20 to 30 seconds. A face mask. A face mask worn at all times will protect healthcare workers. Remove respirators and surgical face masks after exiting the patient's room. All patients and visitors must always wear surgical mask or cloth mask while in the facility. Do not hang surgical masks around your neck and do not store them in your pockets. Do not touch the front of a mask or respirator. Perform hand hygiene immediately if you adjust or touch your face mask or respirator. All healthcare workers must have a fit test done. Before using a respirator, do a seal check. High efficiency respirator must be used for aerosol generating procedures. Healthcare workers with beards must wear a PAPR or powered air purifying respirator. A PAPR must be cleaned and disinfected according to the manufacturer's guideline.